Today we will discuss an essential topic, hemodialysis for drug and toxins overdoses. Knowing which drugs require hemodialysis is critical for clinicians and students alike. We'll use an easy mnemonic to help you memorize these, and I'll explain when to dialyze in each case. Let's dive in. Here's the mnemonic to remember the drugs requiring dialysis. The little bar, selling heavy alcohol, is closed. Let's break it down. The is for Theophylline, from little, remember lithium. Bar for barbiturates, especially phenobarbital. Selling is for salicylates like aspirin. Next is heavy for heavy metals like lead, mercury, and arsenic. Alcohol for alcohols like methanol, ethylene, glycol, and isopropanol. Is for isoniazid. And finally, closed for carbamazepine. Now let's discuss when hemodialysis is needed for each. Our first drug is Theophylline. Hemodialysis is needed when patients have severe toxicity with either refractory seizures or persistent tachycardia or arrhythmias. Another indication is Theophylline levels more than 80 to 100 microgram per ml. Next is lithium. Dialysis indications are serum lithium more than 4 milliequivalents per liter in case of acute toxicity. In case of chronic toxicity, look for neurotoxicity, renal failure, or levels more than 2.5 milliequivalents per liter unresponsive to other treatments. Third on the list is barbiturates, especially phenobarbital, a CNS depressant. Dialysis indications are when the drug causes severe CNS depression or coma, unresponsive to supportive treatment. Next on the list is salicylates, which is aspirin. We only need to dialyze when aspirin causes severe metabolic acidosis, unresponsive to bicarbonates. Serum salicylate levels more than 100 milligrams per deciliters in acute cases, or aspirin causes mental status changes, renal failure, or pulmonary edema. Next are heavy metals like lead, mercury, and arsenic. Dialysis is only used as a last resort when chelators are ineffective or levels are critically high. Now to toxic alcohols one by one. First, methanol. Dialyze if methanol causes vision loss or severe metabolic acidosis with pH less than 7.25. Second is ethylene glycol. If it causes kidney injury or severe metabolic acidosis, we need dialysis. Last one is isopropanol. Patient needs dialysis in cases of severe CNS depression or hemodynamic instability. Now, Isoniazid, which is an anti-tuberculosis drug and prescribed with vitamin B6 or pyridoxine to prevent neuropathy. Dialysis may be needed if it causes seizures or coma, unresponsive to pyridoxine therapy. In case of carbamazepine toxicity, dialyze only if it causes severe neurotoxicity or if serum carbamazepine is more than 40 microgram per ml. Remember, hemodialysis is often a last resort, so it's reserved for life-threatening conditions or when conventional treatments fail. Monitoring lab values, symptoms, and patient stability is crucial in determining the need for dialysis. That's it for today's video. Keep this mnemonic in mind. The little bar selling heavy alcohol is closed to recall these drugs in emergencies. If this was helpful, don't forget to like, share, and subscribe for more high-yield medical content. See you in the next video.